What's up, everyone? Dr. Eric Jackson here. We are continuing our discussion on pH and the importance of pH for your oral health. Last video, we discussed everything from the basics of pH to the dissolving, the pH at which enamel dissolves and dentin dissolves. We also touched on a couple more prominent fads, people trying to get healthy but not thinking about repercussions of their actions, namely the apple cider vinegar, spooning that in and eating that directly, and then the big old glass of lemon water. And then we finished with a little bit of saliva talk. We wanted to start today a little bit more about one of the classic discussions about pH. It's classic soda and diet soda, right? Everyone knows that soda or pop, depending on where you're watching this from, right? But soda is essentially bad for your teeth. It's got sugar, it's acidic, so everyone picks on Pepsi and Coke, but there's endless numbers of examples, right? So people who have become aware of that, and it's actually pretty well known now, obviously. The American Dental Association's Got Rot campaign did a great job in putting the word out about high sugar beverages and foods like soda that can rot your teeth out. So it's pretty commonplace knowledge now that sodas are bad. A lot of people, though, unfortunately have switched, I find, from regular soda to diet soda. Yeah, they say, oh yeah, there's no sugar in this. There's zero calories, or there's an artificial sweetener, so it's no big deal. The problem is they're also forgetting the other half of the equation. It's not just sugary drink, it's a sugary acidic drink. So they're removing the sugar, but they still have a acidic Diet Coke or a Diet Pepsi. And that's causing them to, like we talked about last video, dissolve and demineralize their enamel and dentin and increase the chance of cavities and just overall lower the potential success rate of long-term oral care. The other category we want to talk about here is sports drinks. Now, sports drinks are becoming more people are becoming more knowledgeable that sports drinks have a lot of sugar in them. And that's why the sports drink companies have come out with low sugar options or even no sugar options. But ultimately, I do want to make sure I mention, the sports drinks were invented for high intensity athletic events. Down at the University of Florida, where it's a bajillion degrees and you're playing football, and that's why it's called Gatorade, because the Florida Gators needed some assistance in rehydrating, replacing fluids, replacing electrolytes, all that goodness that you all know from the commercials. The problem, though, is that it's being fed a lot to young athletes, and it's pretty statistically unlikely that your child really needs that much Gatorade. It's more of a tasty alternative to water. But the problem is it's, again, sugary and acidic. So without doubt, the best possible way to replenish and rehydrate is absolutely good old-fashioned tap water. It's got pH neutral 7. It's sugar-free. It's those are the two big things. It's also, the price is right. It's usually free. If you don't have very good tap water, water in general is fairly inexpensive, especially when it comes to comparing it to sports drinks and things like that. So it's an economical option as well. That's something I really want to make sure I mention. Push for water, get some water in your system. And then if you're still thirsty, if you're so dehydrated or whatnot, well, then maybe you could reach for a Gatorade or whatnot. But make that first initial guzzle a big old jug of water. A disturbing trend that I've seen more is that Gatorade is, especially in youth population, is kind of seen as healthy, right? It's not a health drink. It's a tool. It's almost like a piece of equipment in your gym bag, right? Unfortunately, that not everyone views it that way. We'll see a lot of kids sitting around playing, video games or just drinking one at lunchtime in their school lunch. It's not a health drink. That's not how this works. So really, please make sure we try to curb that habit. It's just too much sugar, too much acid. And again, a glass of water is a much better choice. You might also consider some juice. Well, juice is healthy, right? Well, to a point. I did a video not long ago about the new guidelines. The American Academy of Pediatrics put out some new guidelines as far as the appropriate amount of fruit juice for age brackets of children. I'll link to it above right here, and that way you can take a look at it. I won't get into it here, but basically, in a nutshell, you want to make sure you're eating your fruit and not drinking it, right? Fruit juice is not always, there's a lot of added sugar, there's a lot of added everything to it. And even if it's one of those non-added sugars, it's still heavily laden with sugar. So we want to make sure that we don't overdo something that could be very tasty and very good, much in the same way that everything, excess is not best, right? So the final thing I'm going to talk to you about is knowing what you're putting in your body, but also how you're putting it in your body. I once had a patient, she's an ultra marathon runner, right? And if you're not familiar with ultra marathons, basically it's a marathon is 26.2 miles. And these ultra marathons are just an absurd amount more than that. It's, I don't think there's any official standard, but it's between, 50 miles, 100 miles. They are grueling races that make marathons look like chump change. And so this was her jam, right? She really enjoyed ultra marathoning. She had a coach. She was an elite athlete. And she comes to me because she was having a lot of tooth pain, a lot of tooth troubles all of a sudden, right? And we sit down, we start talking at the comprehensive initial exam. And through our discussions, we find out that her training, her coach, is having her wake up every couple hours to hydrate with sports drink to make sure that she's maximum hydrated throughout the day and throughout, so she can train at optimum performance. Just like with the example from the last video with the lemon water, for example, it's a healthy option. You're trying to, speed metabolism or do whatever you think it's going to do. But unfortunately, that trainer was forgetting the collateral damage to this. I'm not a sleep doctor, but ultimately waking up every 2 hours strikes me as it may mess with your rhythms, your sleep patterns, your REM sleep. That's for a different person to weigh in on. But I do know that waking up every 2 hours and bathing your teeth in sugary Gatorade and whatnot yields big problems. And that's what she had. She had, unfortunately, big rot in every single tooth, in her mouth. And it was a big project to get her back. Plus, she had to then work with the trainer to kind of figure out how to do this. Now, if she had woken up every 2 hours and drank a big glass of water, it really wouldn't have happened. Her sleep patterns, I think, would have been still messed up. But ultimately, even if that wasn't a factor for her, maybe her body can handle that. It wouldn't have been introducing that sugary, acidic material and just constantly bathing her teeth. So again, water, water, water. Now, not all water is the same, by the way. We're going to continue next time talking about that. So a little teaser there for you. But for right now, thank you so much for listening. Hope it was a fun addition to the series. And I'll see you for part 3 next time. Thanks so much. Bye-bye now.